Hello, everyone. Good morning. Good morning. Thank you once again for joining. We have our doctor already on the call, but I would like to do just a few introductions about R-Jolad. R-Jolad Hospital is a multi-specialist hospital located here in Lagos. We have branches across Agege, Ikeja, Magada, and we have something coming up in Surulere and also Isolo. We'll be starting the presentation anytime now. So I'll hand over to Dr. Omolola to commence.
Good morning, everyone. It's a pleasure to have you here with me. My name is Dr. Omolola Salako. And very quickly, I would spend the next 25 to 30 minutes, just sharing and explaining 12 ways you can prevent cancer because it's a preventable disease. So please, if you would be kind enough to share my slides, please, and we would run through it. And so just to state that February 4th was World Cancer Day, and every year the entire global cancer community come together to intensify our efforts in raising awareness about cancer. And so the reason why Pearl Oncology and R-Jolad Hospital, find it important to educate the public, through our network of corporate and community is because cancers are preventable. Sadly, a lot of people don't know how to prevent cancer. And where I sit as an oncologist, it's usually from a place of regret that certain patients should not even have developed cancer in the first place. But we are forced to treat this patient. It would have been better if we had educated them, to prevent the cancer, because cancer is already, nasty disease, a difficult and challenging disease to deal with as the patient, even as well as the cancer care team. So I would quickly run through 12 ways you can hack cancer or prevent cancer. Next slide. At the end of this session, you'll understand what cancer is and how you can prevent it. So I would like you to have a sheet of paper and biro or pencil so you can have your own personal plan created. I'm going to run through quite a number of risk factors and how you can prevent it, but I'm aware that many people have different circumstances. So your cancer prevention plan will be different to another person's cancer prevention plan. So just have something you can take notes on in an applicable way. So the essence of having this note is to say, I will do this. I will stop this. That's the essence of this session. It's not just to educate you. It's for you to understand what cancer is and have a strategy, like a 12 strategy plan on how you can prevent cancer. The second objective is you learn 12 modifiable risk factors and lifestyle environmental factors that you can modify to reduce your risk and how you can mitigate them. And the third objective at the end of this session is you'll learn how you can make small changes in your daily lifestyle habits, from nutrition to exercise and many other factors to help you reduce your risk. Next slide. At the end of this session, I want you to walk away with at least 12 strategies that are unique to you. And these strategies would also be useful to your loved ones, your friends. So make sure you share the information. By way of introduction, I'm Dr. Omolola Salako. I'm a radiation oncologist. I'm also a clinical oncologist. I'm trained and licensed in West Africa to treat cancer patients, solid cancer cases. I mean that by breast cancer, prostate cancer. I'm not a specialist when it comes to blood cancers, leukemias, and all of that. But when it comes to the most common cancers affecting Africans, breast cancer, prostate cancer, cervical cancer, liver cancers, that's my job. As you may know, we have a severe shortage of healthcare specialists in the country, as well as we have a shortage and exodus of the workforce treating cancer. And that is why it's more important to prevent cancer than focus on treating cancer. Next slide, please. So a few weeks ago, I put up a LinkedIn post a few days ago, actually, last week, I put up a LinkedIn post and I documented the worst breast cancer case I've seen in my 20 years of practice. And the story just started as this woman was brought in, unconscious. There was a huge mass on her breast as big as a football. And when we went around the entire history, it was obvious that she had hidden her symptoms from her family. And she orchestrated a process that didn't allow her family discover she had cancer. Unfortunately, her children were abroad and she found a way of separating herself from her husband right within the home just because she was hiding that breast lump that started as a granite-sized type of lump. And all of a sudden it became a breast mass. And she still found ways of hiding it. People knew something was wrong, but she never came out. She suspected it was cancer. Anyway, when she landed in our hospital about a year after she saw her first symptom, it was already too late. And the reason why this happened was because she was ignorant. She didn't want a diagnosis of breast cancer. She suspected that lump was breast cancer. She went for prayers, potions, herbal medications, everything she did, but she refused to go to the hospital. Now, you can't change cancer. Well, as Christians, we may say there are miracles and all of that, but scientifically, we know enough about many diseases to treat them. And treatment starts in the hospital. So eventually, she died from her cancer, and she just made many wrong decisions from a place of ignorance and a place of fear. So this is to acknowledge the fact that when someone has a symptom and they suspect it is cancer or they suspect it's serious, if you know them, the first thing you have to do is counsel, guide them, talk about the fears. Then hopefully they can accept going to the hospital early. Next slide. And this is very common amongst Nigerian cancer patients, not just breast cancer patients. The fear of cancer diagnosis keeps them away from the hospital, makes them present to the hospital at a very late stage when we cannot do much relating to curing the patient or, delivering chemotherapy and radiotherapy that will keep the patient longer, keep the cancer at bay. A lot of times, like that breast cancer patient I initially talked about, all we could do for her was to reverse the infection she had that was so severe that made her come in unconscious. The only reason why she presented to the hospital was because the breast mass had become infected, had, knocked her system out, and she fell unconscious. And that was when, against her will or knowing to her, because she was unconscious, she was moved into the hospital. So we spent a few months treating infection, hydrating, blood transfusion, but we never got the opportunity to treat that breast cancer. So at the end of the day, it was a lose-lose situation for her, because it was breast cancer and she never got treated, for her family, who she kept in the dark, and for us, the medical team, that had to take care of all the symptoms, but we never got the opportunity to treat a cancer that is treatable. Okay. So in terms of cancer, there are many symptoms that can occur. With breast cancer, we talk about breast lumps. With colon cancer, we talk about changes in bowel habits, pain, and it's to talk about bowel cancer, which we also call colon cancer or colorectal cancer. Last year, I took care of about 30 colorectal cancer cases. Many of them could have been detected earlier than they presented. Many of them could have been cured. Many of them presented to the hospital as emergency cases. And so with colon cancer, the way it starts, it usually starts as a tiny boil. It usually will not cause symptoms. But if we go looking for it, if we see it, we will remove it and reduce the risk of that tiny boil becoming a big mass as this. It is usually when the mass has grown this big, this heavy in the intestine, it pulls the intestine down. sort of twists the intestine. As you can see, the intestine is like a long rope. And so when something heavy is attached to it, it can twist itself and cause intestinal obstruction. And that is an emergency. The patient has this excruciating pain. And of the patients I saw, most of them presented this way. In the emergency, then the surgeons went in, and found a mass, removed it, sent it to the lab, confirmed it was cancer, then they called the oncology team. Meanwhile, the way colon cancer starts is it usually would have started 20 to 30 years before it became this big mass. It usually would start as a tiny pimple in this same colon. And if left alone over 10, 20 years, it becomes as big as this, becomes a medical emergency. And by the time we are called in, the cancer of this size has usually spread to other parts of the body. So this is just to say that sometimes cancers give early warning signs, like a change in bowel habit. Again, a change in bowel habit means everyone knows their bowel pattern, for example. And I think that's the first question I would ask you. What's your bowel pattern? On your sheet of paper, do you go to the toilet once a day, twice a day, once every other day? What is your bowel habit? What's normal to you? And so a change in bowel habit means that, for example, in January, the first week in January, the person normally goes to the toilet, to stool once a week. And all of a sudden, it becomes diarrhea. The third week in January again, it changes. They don't go to the toilet for like 3 weeks. And when they poo, the poo is very hard. So a change in bowel habit starts with you knowing what is normal for you. Next slide, please. And the reason why we must help people prevent cancer is because 40% of cancers are preventable. As simple and as good newsy that is, the truth is we are not preventing cancers as much as we should, because a lot of people lack awareness. They just don't know how to prevent cancers. A lot of my cancer patients, if they had the knowledge, I know and they know, they would have done anything and everything to prevent cancer. And this is the truth. Almost everybody creates a cancer cell, because cancer cells are mistakes of our normal cells. Why they make that mistake, we don't know, but it happens. So it's important that we have a good approach to our healthcare. If you have health insurance, you should take advantage of your medical checkup. If you have a family history of cancer, there are certain steps and many steps you should take. There are certain risk factors that make people at a higher risk of developing cancer, and we're going to go through them very quickly. So this is to say that 40% of cancers are preventable, and this is because research and science has done so much to tell us these are the cancers that are preventable. These ones, we can't prevent it, but we can detect it early. These ones, we cannot detect this group of cancers early, but we can treat it when they present. There are two reasons why cancers are preventable. Number one, we have the knowledge, which I will share with you, and I'm already sharing with you. And number two, it's the fact that some cancers give us early warning signs. And this is one of the main reasons why we are not preventing cancers, because some of these cancers have started 30 years ago. If only we check, we will pick it up. And that is why cervical cancer is one of the most preventable cancers. Yet in Nigeria, 14,000 women every year would develop cervical cancer. Next slide. And so it's important, and I'm grateful to all of you present on this call. I see there are over 50 people on this call. To understand who needs to prevent cancer, it's everybody. Cancer is no respecter of age. It affects young children. In fact, a few babies have been born with cancer. At least I've seen that twice. A set of twins, one had, it was even a rare form of cancer. The child had 3 cancers, the 2 eyes and a brain cancer. I've forgotten what we call it, but it's so rare that when we saw it, we had to call ourselves, all of us had to get involved, all the Nigerian oncologists, to see it and experience it for the first time, quickly read it up, get counsel from other countries that had, treated such a case. And then we went on to treat the child. But I remember we started treatment at 3 months old. We couldn't start treatment when the baby was 1 month old. Okay, so some people have a family history of cancer. It means they have a high risk. A high risk of cancer means that at least 3 to 4 people in the family have cancer from one line, from the maternal side or from the paternal side. For example, I treated someone about 7 years ago. She had breast cancer. She mentioned one of her sisters had a breast lump, but they never discovered it. 6 years after, I treated another sister who had breast cancer. So it's important to know your family history. In some families, it's cancer, some families, diabetes, hypertension. It's important to know what your family history is, because certain genes can be inherited. But I must mention that inherited cancers only cause 10% of cancers that we see today. What I mean is, if I'm treating 100 breast cancer patients today, only 10 of them are due to family history. The remaining 90, we don't know what has caused it, maybe environmental. So you need to be particular and deliberate about cancer prevention if there's a high risk or strong family history within your family. The second group of people, if you are managing diabetes, hypertension, stroke, or any other condition, infectious conditions, it is important you pay attention to your medical checkup, because some of the risk factors that cause hypertension, diabetes, are brothers and sisters with cancer. So it's important that if you're diabetic, you're hypertensive, this is not to scare you. Use your medications. That's what I'm recommending, as well as ensure that you are doing your full medical checkup. You're not just focused on diabetes and hypertension or whatever else you're treating. One of my research projects was to study how many cancer patients have hypertension or diabetes. 30% of them. In every 3 cancer patients you see, 1 of them will have diabetes or hypertension. So there's a complex system going on when someone is diabetic or hypertensive. There's something about the system that it's a little bit unable to protect itself. Therefore, you must ramp up your attention to your general medical checkup. The third group of people are those of us that have influence on the health decisions of people, whether you're a business owner, a leader, HR, a church leader. It's important you encourage people to, make healthy decisions for their health. And then for those who are HIV positive, hepatitis B virus positive, it is important that you do certain medical tests related to cancer, because certain cancers occur because of HIV and hepatitis B virus. Again, a few liver cancer cases I managed last year were due to hepatitis B virus. It's one thing to be hepatitis B virus positive. It's another thing to monitor the liver that the virus is not changing the normal cells to cancer cells. There are some viruses within the human body, when a human being is infected with these viruses, that can change a normal cell to a cancer cell. Therefore, you must have a team of doctors just monitoring through medical screenings to ensure that is not going on. And should it occur, early interventions can be taken. Next slide. So what is cancer? A lot of times people are like, what is this cancer? What is causing this cancer? And I'll use this image to explain. At the image below that shows 2 cells at the bottom is a normal cell. As adults, most of us have stopped growing. So we have enough cells within our body to sustain us, to help our body function normally. The only time cells need to divide in an adult is when maybe something has been cut off and it has to replace itself. Like maybe the hair has been cut off. The cells in the skin, the follicles will grow. Maybe something scratched or injured the person's skin, then the cells will be called to divide and cover up. It's like a makeup. But for children, because they are growing, the cells are dividing normally. One cell, if you look at the picture on the right of your screen, the mother cell, which is the orange and pink, when normal, will divide to 1. 1 will divide to 2, and 2 will divide to 4. In a time-appropriate manner, it divides like a gentle lady, like a gentleman. But for cancer is such a troublesome disease that it is so abnormal. It is like a rebel. It is I don't want to use such words, but it is a rebel. It will not listen to the command of the body. It will divide uncontrollably, haphazardly. What makes it divide? What makes it lose its instructions? We know some of it. But most of the times, we don't know why cancer cells all of a sudden just divide from 1 to 10. And when there are about 20, 30 cells, they form a lump. So this is just to help you understand that cancer doesn't always present as a big lump. It usually starts in a very microscopic way. When it's big enough, then we begin to pick small lumps, or our scans can pick them up. But because a lot of people are not focused on their health, we are not picking these cancers when they are in their microscopic stage or in their smallest forms. Most times, 80% of our cancer patients in Nigeria present when there's an emergency or it is very, very obvious to the eye. So cancer cells divide fast. The danger about cancer cells is the fact that they are able to invade anything they are close to. If a blood vessel is passing on its own gently, cancer cells can invade them. They also can spread, and this is what makes cancer life-threatening. If a cell can travel from the breast to the brain or to the lungs, that cancer cell, what it wants to do is take over the function of that organ. And some of our organs, like the liver, the brain, the kidney, we cannot do without them. So that is actually what makes cancer very fatal. Its ability to spread to life essential organs and take over their functions. Now, it's important to know that cancer has been documented in many parts of the body. There's cancer of the skin, eye, throat, and so on and so forth. But 3 places cancer has not been documented. We've never documented cancer of the hair, cancer of the teeth, or cancer of the nails. Next slide, please. So how many people get cancer? Millions of people get cancer. In Nigeria, in 2020, it was documented in our hospitals that 125,000 people had cancer. And majority of the people that had cancer were women. And 63% of the people that had cancer died from their cancer for many reasons, one of which is late-stage presentation. Could we have prevented some of these cancers? Could we have prevented some of the death? Absolutely, yes, we could have. At least 50,000 cases could have been prevented in 2020. But many patients didn't know how to prevent it. Next slide, please. So now we're going into the 12 hacks. And this is where I would like you to personalize this conversation we're having. If you have questions, it will also be a great time to put it in the chat box. and I'll attend to them at the end of the session. So the first thing is, okay, so before I go to the 12 hacks, there are 4 things I actually want you to understand about cancer. And I touched on this earlier. What we know about cancer is that it occurs when the genes have a fault. And if you look at the image on your left, the before is quite normal. The DNA is normal. But when there's a mistake in the DNA, in the genes, then the arrangement is broken. Sometimes the body is able to repair the damage and it moves on. And anything can cause the damage. The damage may have been inherited, or the damage may have occurred from one of the risk factors. Smoking. Smoking damages cells, smoking damages DNA. And the good thing about our body is it will repair itself. The good thing about nature is it will repair the damage. But when someone is exposed to the same thing that is damaging the DNA, damaging the genes constantly, and it may be stress, it may be what we eat, there are different risk factors that can damage the DNA, damage the gene, and command the cells to start dividing uncontrollably and abnormally. So that's the first thing I want you to take, that a lot of cancers are caused by genetic mutations. We understand some of them. For many of them, we don't understand why the genes go bad. The second thing I want you to note is these faulty genes or mistakes in the genes can be inherited at birth. Next slide, please. The third thing is some of the faulty genes may be acquired here on Earth when we are exposed to risk factors, when we are exposed to agents that damage cells, and especially if we're constantly exposed to those agents. They may be chemicals. We call them carcinogens. Anything that a human being is exposed to that increases their risk for developing cancer is called a carcinogen. Many times when we see our cancer patients, research and science has taken a lot of blood samples from a lot of millions of cancer patients, and we've gone in to look at them under the microscope to see that the genes are abnormal. And when we sit with the patient and ask them a long set of questions, what happened? What were you exposed to? The reason why we're doing that is we want to identify, was there anything they were exposed to that could have caused the genetic mutation and led to the cancer? And this is to say that some people have genetic mutations, faulty genes, but they won't develop cancer. So again, we still have some questions unanswered, but we know enough. We know 12 strategies to prevent cancer. Next slide. Yeah, so we're going into the risk factors, and I just want to highlight that some people will be exposed to risk factors. Some people are smoking and they won't develop lung cancer. While there's a type of lung cancer that is common in women, and we're seeing it a lot in Nigeria, and the lung cancer is on the rise in Nigeria, and they have no history of smoking. They've not smoked a stick in their life. The best they have done is maybe inhaled cigarette from maybe passing by someone who was smoking, which is not enough to say that's the cause of the cancer. So this is just to say that sometimes we know risk factors that can increase your risk. You may be exposed to it for a long time and you won't develop cancer, while there are some people who are not exposed to anything and they develop cancer. Next slide, please. So number one, the first way we can hack cancer is our diet. And my question to you is your diet balanced? Yes or no? Balanced means, does it contain the right amount of different classes of food? If you look at this picture, this diet is rich in fats, carbohydrates, processed food, sugar. The body doesn't need that. What the body needs: vegetables, protein, carbohydrates, minerals. I don't mean soft drink, like minerals, zinc, selenium. And these are things that can be found in natural products like grains, legumes, beans. So what is your diet like? How can you improve your diet? A lot of us eat carbohydrates, rice, stew, and meat. And if you look at the portion of your rice, are you able to reduce the portion of your rice and replace it with some vegetables? So if you have your plate, about 50% can be carbohydrates, 30% vegetables, and 20% protein. And after that, you can have your fruit. That is a balanced diet. English breakfast. If you take a look at English breakfast, in fact, that should have been the picture I would put there, you would see that they are intentional about the size of food, the portion of food, and the colors on an English breakfast tray. You have a bit of butter that gives you fat and oil. You have your slice of bread, which is not as much as rice. When we are eating rice, just a few slices. You won't find 6 slices, 2 to 3 slices. You will find some processed food like sausage and all of that, which is not healthy. So let's ignore the sausage, the bacon, anything from pork is really, really, really not healthy, especially when it is processed. Then you have egg. It may be fried, it may be boiled, but you will find the fruits. You will find potatoes, which, are vegetables. So what is your diet like and what can you do today? How can you improve it? It may mean that you reduce your carbohydrate and, put in more fish, which is protein, which is affordable, or put in your chicken, your turkey, whatever you like. Avoid the skin of all of these animals because they have high fat content. So it's just a matter of you being conscious of the amount of food that you are eating at time and how many classes of food do you have. So a balanced meal is rice and beans and your protein, and have something after it. Fruit, a slice of apple or a slice of banana. Number 2 is tobacco. Whether you are smoking it, you are using the pipe, or it's the shisha, or it's the snuff, or it's the betel nut, as long as it has tobacco, it is a problem. Tobacco is known to cause cancer. If you put 50 rats in the laboratory here and you you insert tobacco underneath their skin, you will find cancer 1 to 2 years down the line in about 30 to 40% of them. So tobacco is a no-no. If you are a smoker or you know a smoker, encourage them to stop smoking and go for recreational, what do they call this thing? Social non-addiction programs. And there are quite a number of these non-addictive programs. The people who are at risk of lung cancer and other cancers are those who actually take a lot of packs for 10 years. And if you take a look at what's happening, some people start smoking at age 15 and they keep smoking till 50 years old, 60 years old. It is common to find cancer in 60, 70-year-old men. So the goal is for you to reduce your smoking packs and then stop it completely. So if you're smoking or you know someone who's smoking, that's one thing you have to work on. There are quite a number of psychotherapy sessions. There are patches. There are drugs that you can be given to help you reduce the addiction and come out of it, especially that you are harming the people around you. Because when you smoke, especially the cigarette, it has a tiny filter. And the most unwanted part of the cigarette is filtered out to the people who are sitting nicely around you, inhaling it. And that is why it's recommended that if you must smoke, it has to be in an open area so that you are not a harm to innocent people. Next slide, please. The third hack is around viruses. HIV, hepatitis B virus, and human papilloma virus are 3 viruses plaguing Nigeria. We have special clinics for HIV patients that have cancer. We also have special clinics for hepatitis B virus patients that have cancer. So the first thing, hack 3, is if you do not have this virus, can we have an agreement that you will not have this virus now and forevermore? If we can agree that, that is hack 3. How are these viruses transmitted? The number 1 route, you can guess it. How is HIV contracted? Number 1 route is unsafe sexual practices, having unprotected sex, having multiple sexual partners, just having sex with someone who is HIV positive, and that's it. You got it. If you want it, it's there in full force. So if you must have sex with someone who is not your partner, then protect yourself. Limit your sexual partners. Unfortunately, some of the things we are seeing in the clinic is this. Married people are bringing infection home. And this is not to say men are causing it for women and women are causing it for men. But in our clinic, this is our reality. When we see a woman with certain types of cancers or a man with certain types of cancers, something that rings in our head is, let's check the HIV status. And when we go into the history, then we find out that, okay, the husband gave it to the woman or the woman gave it to the man or whatever. So number 3 hack is, if you are not HIV positive, hepatitis B virus positive, can you please be kind enough to we, the oncologists, that don't want to treat you? We don't want more cancer patients because we are not enough and we are running, like we are losing our minds. We are seeing things we shouldn't be seeing. Our skills are not put to the best use because we are not able to cure as many patients as we are taught and trained to. So it's almost a disservice to us to know how to treat cancers, cure cancers, but we can't. So please, can you, sort of not get infected with these viruses? Because for real, we are receiving HIV patients with Kaposi sarcoma, with cervical cancer. I remember there was a lady during my training, she was fully covered with the hijab and everything. And she came in with cervical cancer at age 35. I was like, nah, madam. Like, I had to call my colleagues because I was in training there, that come and see this. Cervical cancer doesn't occur in young women. It occurs in 50, 60, 70. What happened? And my professor said, what do you think happened? And I was scratching my head like, I don't know. And he was like, check her HIV status. When you see cancer presents in a different way, there's something else that you have to look out for. And so when we checked her HIV status, we went to read she was HIV positive and the story. So HIV does not discriminate whether you are a nun, whether you are holier than thou. As long as you have sex with an infected person or you have access to multiple sexual partners, certain viruses are transmitted. Other ways these viruses are transmitted is through blood transfusion. And thank God that has reduced significantly because many states have taken it upon their head to screen the blood before patients are transfused. And there are like 4 layers of cross-checking that blood that it doesn't contain HIV or any other infectious agents before we transfuse patients with such blood. So hack 3 is you have to do whatever it takes not to be infected with any of these viruses that are sexually transmitted. There are other viruses we cannot even control how they are transmitted. But most of the viruses causing cancer in our setting are these ones I have talked about: HIV, human papilloma virus, and hepatitis viruses. The 4th one, hack, is sunshine. So cancer can occur on the skin when you are exposed to too much sun, especially if you are fair or you're an albino. So if you know anyone who is an albino, they really have to protect their skin from the sun, wearing hats, wearing shirts, things to cover their body, especially if they're outdoor workers. It's as bad as a lot of us that know this. There are people working within the Albino Foundation. We have an Albino Foundation in the country, Oncologist. One of the things we've always said to ourselves is it pains us when we see an albino come down with cancer because they just didn't know. And this is a strong message within the albino community. And over the last few years, a lot of people, albinos and fair-skinned people, are using their sun protection factor. It is not luxury, it's not shakara, it's not yanga. Ultraviolet radiation from the sun hits all of us. You know how hot it gets and how it hits your skin hard. Fair people and albinos don't have enough melanin to protect them from the damage of the UV radiation. If you have, if you're a melanin brown skin person, melanin protects you. If you are fair or an albino, you have less melanin, so you have to put an extra layer of protection by wearing things that protect your skin from the harshness of the sun and applying, skin products that have sun protection factor. Next slide, please. Now, some people are born with moles on their body. It can be anywhere, on their head, on their back. Moles are like dark dots, and they are born with it, just like some people are born with birthmarks. If you have a mole that came up at birth, as long as it is not growing bigger, it is not itching or bleeding, then you can leave it alone. But if you notice any of those three things, all of a sudden the mole is itchy, it's getting bigger, then or it's bleeding, you need to present to your doctor for an assessment. The fifth way you can hack cancer, and this is for people who already are HIV positive or are hepatitis B carriers, it's important you see your doctor. There are certain steps you will take and you must take. There are certain tests you will do that other people that don't have HIV or hepatitis B will not do. If a woman is HIV positive, she will start her cervical screening many years before a non-HIV woman. So there are certain things that are unique to the HIV population and hepatitis B population. There are certain drugs we will place you on. Number 6 hack is cancer screening. On this image, once you're age 25 years old, there's certain cancer screening you must do as part of your medical checkup. Your medical checkup checks your heart, your kidney, your brain, checks everything, that everything is functioning and, the stress, aging process is not, causing wear and tear. But there are certain cancers that must be checked for from age 25 because they start giving us signs as early as that. Most cancers don't start 1 year ago. If we diagnosed it this year, it started 10 years ago, 15 years ago. So if you're a man or a woman, colorectal cancer screening starts from age 50. In Nigeria, we're drawing that back to 45 years old because the truth is 30% of our colorectal cancer cases occur in 20s and 30s. But majority of cancer cases occur 40-something and above. When you do your medical checkup, one of the cancer screening tests we ask for is your stool. We want to check if there's blood, because one of the very early signs, before the tummy starts paining, before the bowel change in habits, we can pick blood. And I'm not saying frank, bright red blood that we can see. I'm saying microscopic blood. So from age 45, we recommend a fecal occult blood test and a colonoscopy. And people say, oh, I don't like colonoscopy. They want to put one wire inside this and they put it inside the anus and they went. A colonoscopy helps us detect the pimple that can become that big mass. So whether you're a man or a woman, you should have a colonoscopy done fecal occult blood test done from age 45. For women from age 25, if you are not a virgin, as long as you've lost your virginity, then you should get your pap smear done. And some women will say, but I had sex once or I had sex 10 times. It doesn't matter. As long as you are not a virgin, you should have your pap smear done from age 25. And that will be done every 3 years. Human papilloma virus causes 90% of cervical cancer. For example, if a girl had sex at age 25 and she got infected with the virus, what the virus does is most times it clears it, the immune system clears it. But for some women, the virus stays for 20, 30 years. When she's 55, then she notices, oh, she's bleeding abnormally. And abnormal bleeding means bleeding in between periods, bleeding after sex, bleeding after menopause. Normal bleeding is menstruation. Normal bleeding is bleeding after delivery. After a baby has been born, a woman bleeds for 40 days. Abnormal vaginal bleeding is bleeding after sex, after menopause, or in between periods. That is the most common symptom of cervical cancer. Other conditions can cause it. But I'm just saying this so that should a woman approach you and say, I noticed I'm bleeding after sex, or I'm spotting and I'm not expecting my period, one of the things we think of as doctors is cervical cancer, and it should be checked out. But before when a woman starts bleeding abnormally, it means she has a mass in her cervix that is big. Before it becomes a mass, we can pick it at microscopic level when it's still like salt grains through a pap smear. We also can confirm if the HPV virus is within the woman's cervix, and that's the HPV DNA test. And there are two methods. You can go into the hospital and get it done, or a HPV self-sampling kit can be posted to you. You take the swab at home, like you're wearing a pad, but you just put like the cotton bud, you put it into the private part. It's not painful. You do it by yourself. It's that simple. You put it back in the pack and you dispatch it. From age 25, you should have a breast self-examination. When you go in to see your doctor, they should check your breast. That's a clinical breast exam, and you should be able to do your breast self-examination once a month. If you're a woman, age 40, you should do a mammogram. If you're a man, age 40, you should start your prostate check. Next slide, please. So hack 7 is, depending on your work, you may be exposed to certain chemicals or certain agents. For us as radiation oncologists, we work with machines that radiate. And so we are exposed to radiation, and that itself can cause or increase our risk of developing cancers. But there are certain badges we wear that measure the reading of radiation. It's the same thing with the air crew, pilots. They are exposed to terrestrial radiation from the moon, the stars, and the sun when they're flying. So there's an amount of radiation they are exposed to, and they calculate that into how many times they travel in a week or in a year. For some people who do tie and dye, they use chemicals that are harmful. And if the person is not kitted up wearing their mask, their gloves, protective wear, over the years, if they continue being exposed to the chemicals, they can develop all types of cancers. Battery watch repairers, vulcanizers, car battery, those mechanics that use chemicals in their batteries, exposure to those harmful, chemicals can put one at risk. It's the same thing with when a lot of buildings, especially the old buildings, were being plastered with asbestos roof. Those are chemicals that when inhaled, the person is just at home peacefully sitting or sleeping in their house, but they are inhaling things from the walls and from the roof. And that has been associated with a terrible type of lung cancer. So the house you live, you also want to be sure of the quality of its product, just as you are also assessing the quality of food you are eating, the quality and the safe practices of sex you are having. Those are the things you have to focus on and not ignore. Okay. So the 8th hack is increase your water intake. You should have 3 liters of water every day. Have your bottle, as in 3 liters as an adult. What that does is it actually clears all the things your body system doesn't need. You need to pee out the things your body has processed as out. So if you don't drink enough water, you are keeping those harmful substances in your body longer. The 9th hack is physical activity. It's recommended that you do 10,000 steps a day. How many steps are you taking? Are you measuring it? You can use smart apps on your phone. You can wear a smartwatch to measure how many steps you're taking. Next slide, please. The 10th hack is get enough sleep. Ilule, we're hearing all types of things. At the end of the day, whether you sleep or you don't sleep, your body will suffer for it, or your body will thank you. One of the ways you can repair your body is through sleep. As adults, you should have a minimum of 6 hours, and you have to make it work. And I find a lot of people saying it in very comfortable terms that they can't sleep for 6 hours. Well, that's your business. Prioritize yourself. The 11th hack is know your family history. Know the strengths of your family. Know the health of your family. Know the weakness in your health family history and tackle it. If you have hypertension in the family, see a doctor and say, this is my family history. What can I do to reduce my risk? If you have an existing illness, and I've talked about this earlier, manage it. Ensure whatever medications you've been giving, use it judiciously. If you're hypertensive, diabetic, don't say because my blood sugar has gone within the normal range, I'm not using my medicines anymore. That agreement should be between you and your doctor. If you are to exercise, whatever you have been told to do, take the clinical advice so that we are not dealing with the complications of the existing disease. Next slide, please. So that's it from me. Thank you for your time. I'm open to questions and answers now.
Thank you so much, Dr. Omolola. That was a wonderful presentation. I learned so much. The floor is now open to questions. If you have any questions for Dr. Omolola, you could signify by raising up your hand and I'll enable your microphone. You could also drop your questions in the comment section or in the chat.
Thank you. There's a hand up.
Yes. Good morning, Mr. Onabi. Your mic should be enabled now. You can unmute to ask a question.
Thank you so much, Doctor. I hope you can hear me. Thank you so
Yes,
much
loud
for
and clear.
sharing. Thank you so much. Thank you so much. I wanted to ask quickly about the role of sugar in cancer and in managing cancer. I'm not sure if I heard that about from you, the role of sugar generally, and what can we do? Thank you.
Thank you. So I would like to take all the questions and then I'll respond to them. Thank you for that.
Okay. We have Folashade's hand up. So let me just. Good morning, Folashade. You can ask your question now.
Okay, thank you very much. And thank you very much, Dr. Ola, for that very, should I say, enlightening and, very, very instructive presentation. I think the first speaker has sort of asked, part of my question. But just to add, because I know you specifically said, we should reduce, in terms of preventing, we should reduce sweet drinks, sugar and sweet drinks. So my question was actually going to ask you, when you say reduce, alcohol, reduce sweet drinks, how often would you advise, or would you say, advise people should take soft drinks? For example, do you say one bottle of Coke a day is too much? One bottle of Coke a week is too much? That kind of that was where my question was sort of leaning towards. I just want to understand the role of sweet drinks actually, in preventing cancer. Thank you very much, ma'am.
Thank you.
Okay, Dr. Omolola, we have some questions in the chat. Someone was asking if keeping your phones close to you for long periods of time at night can cause cancer.
Keeping what, please?
Phone, electronic
okay.
device. Another person is asking if women should only do pap smears as a method of hacking cancer. Someone is asking, to shed more light about the HPV vaccine. And she wants to know if it's advisable to get it. Those are the 3 questions we have in the chat.
Excellent. So 5 questions here. So the first questions, and thank you all for your questions. The first question about what's the role of sugar in causing cancer. There is a controversy about this. Some school of thought feel that sugar causes cancer. Other school of thought feel that it doesn't cause cancer. But this is my personal opinion. We don't know many things about cancer, but just take sugar in moderation. Sugar is a refined product. It's not a natural product. And we know that processed foods, refined foods, or products can increase the risk of cancer. So one of the ways you can live healthy is to reduce your sugar level. And this is across what you take on a daily basis. If you like tea, do you take 2 cubes or 1 cube? Just reduce a bit more. Do you take tea every day? When you take tea every day, that's a lot. Can you reduce it to 2, 3, 4 times a week? The thing is about progress. But to hit the nail on the head, sugar is a refined product. It is not the best thing you should take in excess. And this is not to say don't take sugar at all. It is reduce it by 30%, then by 50%. And it's okay. You don't have to stop sugar completely. But it's a refined product that the body, finds harder to excrete out. Sugar is not directly linked to cancer according to research, but it is linked to other diseases like diabetes, hypertension, and other chronic diseases. So if it is not, sugar is just a sweet good to have. It gives us a good feel. It gives us a high, whether it comes in soft drinks or we're dropping it in our tea. The goal is for you to reduce your sugar content. Going to the second question on reduce sweet drinks. Yes, please. Carton drinks, juices, soft drinks, reduce them. They are not compulsory. They are natural, nutritious alternatives. So if you want to drink orange juice, you can drink the freshly squeezed orange juice instead of packet juice. You can invest in a smoothie blender and go for an alternative to your drinks. You can blend what's this thing called? Beetroot, carrot, ginger, and pineapple is a fantastic natural drink that not only boosts your immunity, it's also naturally sweet. You can replace sugar with honey. So the goal is, I'm not saying don't drink sugar, don't eat sugar. It is what can you reduce by 30% and how will you go about it? To the third question, keeping phones close. Don't keep your phone close. It is a source of stress. That's the number 1 reason. Number 2 is phones actually emit radiation, just like microwaves. But these radiations are not strong enough to cause cancer. That is what we know now. It's possible in 50 years, we'll find out that it was actually associated with cancer. Just like sugar, it is controversial. There are two schools of thought that the more you put your phone to your ear, you are at a higher risk of brain cancer. But a lot of our patients are coming down with breast cancer, with brain cancer are children. They don't even have phones. Brain cancers are more common in pediatric than. So we can't really link these things. And that's where we'll always put question marks. We just don't know. But just from a natural point of view, is it normal for you to put radiation near your body? No, it's not healthy. So don't. And the rule is for your productivity, to manage your stress level, carry that your phone, put it outside. Not even close to you or on the floor charging, like put it outside, put it on low volume and have a good night's sleep. To your fourth question, pap smear, is that the only screening for women? No, depending on your age, depending on your age for women. From age 25, you should see your doctor for a clinical breast exam. If you're not a virgin, you should have pap smear done. You should have HPV DNA testing done. And you should have a full medical checkup. Check the heart, the lungs, we'll take blood tests. And as you get older, as you approach 40, we begin to add other tests like a mammogram. As you approach 45, we add another test like the colonoscopy. And then depending on your unique health and your family history, we know other tests to add. And to the fifth question, HPV vaccine. Thank you for that. For that. So the federal government of Nigeria rolled out a free HPV vaccine for girls from age 9 to 13 years old. And this is global practice. Like in US, cervical cancer used to be the second, third commonest cancer in women. Now it's like the 10th commonest cancer. This is because, one, their girls were vaccinated 10, 20, 30 years ago. So now that they're in their 40s, 50s, even though they're exposed to some of the viruses, HPV, they're not coming down with those cancers because they were vaccinated years ago. So this is me saying that for those of us that have girls between the ages of 9, take them to the nearest primary healthcare center in Lagos State. The vaccine is free. And should you want to go for private, then walk into R-Jolad, into one of the family clinics, get your girls vaccinated. As mommies and daddies, it's our responsibility to have a generation free of cervical cancer. And that decision is ours to make now on behalf of our children. If you're a woman and you've been exposed to the virus, you've had sex, the chances that you've been exposed to the virus is very high. Luckily, our immune system clears it. You need to do the HPV DNA test. If you are negative, then you can get vaccinated. You also have to do the pap smear. So primary cancer prevention means you eliminate the thing causing the cancer, which is the HPV virus. When we vaccinate young girls, that is primary prevention. For older women, that is secondary prevention. Thank you.
Thank you, Doctor. We still have a couple of questions. Hope you have some time. Shegun would like to ask his question. His hand is up, so I'm just going to enable his mic. Mr. Shegun, you can go on and ask the question. Okay, while we're waiting for him, we have another question. Someone is asking if IUD Mirena family planning causes cervical cancer. She's asking because she's yet to see her period and she has some vaginal itches. So she's trying to find out if that is a risk factor for cancer.
No,
Someone else. Okay. Someone else is asking that for those who used asbestos to construct their homes, that is that a cancer risk factor? And that we should please differentiate between a mole and a skin tag in cancer. Then someone is asking if honey is a better alternative to sugar when it comes to sweetening, what they consume. And someone's also asking about beverages, whether taking beverages can affect the result of the chemotherapy. So those are the questions.
You said that again. Can beverages?
Yes. Can it apply to beverages? So should the person be taking beverages during chemotherapy, that if they take it, can it affect the results of chemotherapy?
Thank you for those.
Yeah.
Thank you so much for your questions. IUD Mirena itching. IUD Mirena is a good product for family planning, important for women to plan their families and use safe contraceptives. IUD Mirena is safe. It's not associated with developing any cancer. We are worried about certain oral contraceptive pills that have a high dose of estrogen in it. And so IUDs tend to, and again, this is my personal professional perspective, I tend to promote IUDs, and Mirena is one of them. So it's safe. There's no science or research linking IUDs to cancer, but certain types of oral contraceptive pills, especially the ones that are used on a daily basis for years, a certain type has been associated with breast cancer. So if you're a woman of reproductive age, planning her family, it's important to have this conversation with your gynecologist. But to your point of you're having some symptoms like itching, you shouldn't itch because of the IUD. So I'll encourage you to see your doctor or your gynecologist. Asbestos is a no-no. In fact, if anybody is building a house right now with asbestos, you have every right to sue them because they're putting the entire inhabitants at risk of cancer. It is a clear cut, it is a regulation. People should not use asbestos to build. We know enough not to use it. So it shouldn't be done. And if you live in a house with asbestos, I advise you to pack out and not deal with cancer down the line. Asbestos is confirmed, so there's nothing, it's 100%, just move out of it. And I want to believe if you know anyone who is using asbestos to build, it's to educate them and probably report them to the appropriate authority. A mole is a pimple. It's not a pimple. A pimple is a pimple, but a mole is bigger than a pimple, is fleshier than a pimple, is usually darker than the normal skin surrounding it. And it's normal for some people to be born with it. Some people are not born with moles. It just shows up on their skin. And it's innocent and it's there. When we talk about cancer, sometimes these normal moles may change and become bigger, itchier, or bleed. Or sometimes cancers can present as moles for the first time. The minute that mole is showing up, growing, getting bigger, it's already cancerous. A mole is quite different to a skin tag. A skin tag is just like a remnant, extra skin. Sometimes it's the color of the normal skin. Depending on the part of the body, it also, there are slight differences, but a skin tag is different to a mole. It's just like the body makes its own errors that are natural, like having a facial mark. Skip my mind, but there's some people that have patches of different colors on their skin, just little parts, or have tiny dots. I know Yoruba people call it a miolon or something like that. I've forgotten what it's called, but that's natural to you. A skin tag is also natural. So moles are natural. Skin tags are not moles. And most times skin tags don't cause. Cancers don't arise usually from skin tags. Other things that can cause skin cancer are people who had burns, maybe decades ago when they were children, maybe a fire burn, chemical burn. Many years later, after healing, skin cancers can commonly arise. People who have been sunburnt, either by the sun or maybe they went tanning, they are at risk of developing skin cancer in those areas. Honey as an alternative to sugar is a good idea, but again, in moderation. In moderation. Honey is natural. It is produced by bees. So it's natural. The system is able to digest it, but in moderation. And the last question is, if you're on chemotherapy and you're taking beverages, it's fine. It's important you eat the normal classes of food. It's critical you take beverages to support what you are eating. It's okay to drink the chocolate drinks, have your tea, have malt drinks. We want you to have as much nutrients naturally from your food. You know, your swallow, your rice. When we're talking about diet and cancer, it's a different conversation completely, because we know when you're on treatment, the side effects of treatment are vomiting, nausea, so you don't really feel like eating, and you may not be taking as much as you should normally. So we want to fortify your diet with other things like beverages, malt drinks, ensure, and things like that. So to your question, beverages are safe, especially if you are going for the popular products that have quality as part of their core values. There are some China drinks that you should not drink. You know, there are some biscuits and chocolates that children are eating. We don't know when they were created. We don't know when they will expire. Yeah. So thank you very much.
My apologies. There are just three more questions and we're done. Someone is asking if how would they know if they've been previously vaccinated for HPV, and that can an adult just walk and take a vaccine? How can they know if they've been previously vaccinated for HPV? And as an adult, can they just go and take the vaccination without the pap smear tests? The second question is, are there workplace or occupational factors that can increase the risk of cancer? And what preventive measures can be taken in such environments? Finally, someone is asking if there's a relationship between psoriasis and skin cancer. And another person is asking how they can book an appointment to see you.
Okay, thank you. Thank you very much for these questions. Okay, so the first question, I feel like cracking a joke, but I won't crack a joke. I don't know how you will find out if you were vaccinated, but what I can say is that in the last few years, HPV vaccines got introduced in the last few years into Nigeria, say about 10 years ago, 15 years ago, max. And so HPV vaccine just got incorporated into the national vaccination scheme last year. So it's not the type of vaccine that you probably would have received when you were a baby or you were a child. HPV vaccines, the earliest the girl gets it is at age 9. So if you can track back, did you receive any? And then maybe asking your loved ones or your mom but usually a lot of women these days, adults, are receiving HPV vaccines in the last 15 years. So if you've received HPV vaccine, I'm sure you would recollect. But if you haven't, then I would say please go and do your HPV DNA test, do your pap smear, and get vaccinated. For adults, it's 2 shots. For young girls age 9, it's 1 shot. And that guarantees protection against 80% of the HPV viruses that cause cervical cancer. Occupational exposure. So each job has its occupational nuances. For those who work with X-ray facilities, some are rig workers, some have to use radiation to drill. Some people are miners, and naturally when they are mining under the floor, wherever they are, under the sea level, or they're exposed to natural radiation elements, and they also have their protection. If you're an air crew pilot and all of that, there are regulatory affairs for regulatory principles that you must follow. If you work with chemicals like paint industry or any chemical at all, there are rules and regulations that you must adhere to. And if you feel you are exposed to something that is not healthy, then you need to understand the lines of reporting it within your organization and coming up with solutions to reduce your risk of that. For example, and recently, this is not related to your question, I saw a lung cancer patient, and as we were going through her history, one of the things she said was, for 10 years, she lived in a face-me, face-you apartment. Her neighbor had a kerosene stove and was always cooking with wood and all things, and the window was linked to her sitting room, and the fumes would come in. I was like, we cannot say now, but there were like 10, 20 people living in that same facility. But so far, only her, came down with. It's possible it may be related to that. It's possible it's not related to that. So the mistake is when something is not good for your body, don't adjust to it. Don't manage it. Create a strategy to get out of that harmful situation. And I'm sure most organizations have their occupational rules, like the oil and gas companies have occupational health departments that take care of these things. And if you don't have that department, then the HR department or the medical department, if it's a healthcare facility, will be the right place to go to. But this is just also to say it's not about work. It's also about where you live. If you're exposed to things, if you're not comfortable living beside a mast, you should create a plan to move out, because you will never know. If something happened, it's because you lived beside him. We are not supposed to live beside masts. That's all I'm trying to say. And then relationship between skin cancer. I'm sorry, I didn't get that last question.
Okay,
I can't read
what's
my own.
the relationship between psoriasis and skin cancer?
Yeah. So psoriasis and skin cancer, that's a great question. The truth is I can't speak confidently on that. Sorry about it. I can't speak to that because it is not, psoriasis is not listed as one of the risk factors of skin cancer. Skin cancers, light, UV light from the sun, exposure to chemicals, being fair skin, having certain, even bleaching cream is not a risk factor for skin cancer, but bleaching cream reduces the integrity of the skin, reduces the melanin, the thing that is protecting us from the sun. For those people that like to look fair, when God gave them brown, you are reducing the skin integrity, the skin immunity, and the skin just becomes unhealthy, but it's not really associated with skin cancer. So psoriasis is also not one of the risk factors that can cause skin cancer, but it is a condition that must be treated by a dermatologist and must be controlled. It can be a troublesome condition, but there's really no link, to the best of my knowledge, between skin cancer and psoriasis. But that's a great question, and I'll look it up just to know what research says about it.
Okay.
Thank you.
Dr. Omolola, sorry, there are two questions that I feel like are really important here. So one is asking about how does tube litigation expose one to cancers? And finally, a woman is asking if a 48-year-old person can still take the HPV vaccine.
What did you call it? Tube what?
Tube litigation. Ligation, sorry. Tube ligation.
Ligation, okay. Don't mind me, I'm just pulling your legs. I thought you said litigation, ligation. Oh my God. So tube ligation is when the tubes of the woman is tied. It's also part of the family planning method that some women prefer to do, or for medical reasons it's done. It's not associated with cancer. Doing that is for a reason, and the effect of tube ligation is not associated with cancer. I'm sorry, I didn't get the last question.
Can a 48-year-old woman still take HPV vaccine?
Yes.
48, okay.
Yes, a 48 years old woman can take the vaccine. And this is just in context of, let's say the woman has had children, has had sex multiple times, probably has been infected with the HPV virus, which most women have been if they engaged in sex, but the system is able to clear it most times. The power of the vaccine is if the female has not been exposed to the virus, just like all other vaccines. We don't want any exposure. So what we like to do is to do the HPV DNA test. If the woman is negative at that point, then we can administer the vaccine. And the vaccine is readily available in our hospitals. With respect to booking an appointment, on Mondays, we run our cancer clinic at R-Jolad Plus from 10 a.m. So if you would like an appointment, please contact the team here at R-Jolad and they'll book you in to see myself or one of the other oncologists. Thank you.
Thank you so much, Dr. Omolola Salako. That was such a wonderful presentation. I think everyone had something to take home from the presentation. I'd just like to add that you can take vaccines. You can come in to R-Jolad facilities to get the vaccines. You can speak to any front desk personnel and they'll direct you to where you can get it. Unfortunately, it is not free at R-Jolad. I think it's currently going for between 8,000 and 10,000 naira. You can just give us a call at any of our numbers and we'll be able to give you more information and we'll be sending the
I'm
slides.
raising my hand.
Okay.
So the reason why I must talk about it cannot be free. And the reason is this: you are investing in your health. If a cervical cancer patient comes to my table, the minimum they will spend is 5 million naira. And I cannot guarantee cure. And there's only one center in this Lagos state that has the 2 machines that can treat cervical cancer. And it will cost the woman at least 2.5 million naira. That is minus surgery. I'm talking of radiotherapy, about 2.5 million. That's minus surgery, chemotherapy, going to the hospital at least 50 times that year. So when we talk about prevention of 8,000 naira, 15,000 naira versus 5 million naira, if we do the maths, we know what we would rather spend money on preventing than treating. So please, let's embrace the screening and the vaccination. Thank you.
Thank you so much. So we're sending more information to the email addresses of people who registered. So if you'd like us to send you the slides and you didn't register, please leave your email in the chat so that we'll be able to send you an email with all the information and the slides and the presentation. Thank you so much for your time. Till our next webinar. Have a wonderful day, everyone.
Thank you, peace. Thank you, everyone that have joined. Thank you.